Good afternoon. This is Ehsan. I've been an oncologist for over 20 years, and I've treated plenty of patients with uterine sarcoma. It's a rare cancer that's often missed, and the reason it's missed is because it's in the uterus, and the assumption is that it is the same as a regular uterine cancer rather than a uterine sarcoma. So, quite often patients go and see their primary care doctor or gynecologist. They've been told that, oh, you got another fibroid, which is quite often the truth. And then a biopsy is done, and then the pathology says uterine sarcoma. If you or someone you love has recently been diagnosed with uterine sarcoma, I hope that this couple of videos can help you better understand what to expect and the outcome. I'm going to talk to you about a 52-year-old patient of mine who worked out all the time. She had 2 grandkids, and she had prior uterine fibroids. She always experienced heavy periods to a point that I had to give her IV iron. She had started feeling some pelvic pressure, nothing really unusual, nothing major, and she never complained anyhow, like most of my patients. And she noticed that her abdomen was getting bigger, and she started having some vaginal bleeding. The bleeding led to anemia, and then she was exhausted. She went and saw her primary care doctor, referred her to her gynecologist, and the first thing he thought, like I would have, was that it's a fibroid. After surgery, the path report showed uterine leiomyosarcoma, and it's the most cancer of the uterus in the sense that it is missed. Because endometrial cancer of the uterus, we all know about, we all think about, because that affects the lining of the uterus. However, uterine sarcoma affects the muscle and therefore is not as common. If you want it to be very scientific, about 7% of all uterine cancers are uterine sarcomas. They're unfortunately aggressive, and I have seen 3 different types, and I've treated 3 different types in my lifetime. One would be a leiomyosarcoma, the other is endometrial stromal sarcoma, and the last one is an undifferentiated uterine sarcoma. And all 3 of them, unfortunately, behave differently. The problem is the symptoms. Unfortunately, it feels just like a fibroid: heavy periods, bleeding after menopause, occasional pelvic pain or pressure, enlarging uterus. You fill up quickly after you eat, you urinate a lot, or you never empty out your bladder. And this deserves careful evaluation, but honest truth is fibroids can do the same thing, so please don't assume that it's always cancer. There is no blood test that's reliable to determine what is a uterine sarcoma. As oncologists or oncologists that do gynecology, we depend on ultrasound, MRI, CAT scans, and generally speaking, it ends up being a biopsy that ultimately gives us the diagnosis of uterine sarcoma. I have ordered PET-CT scans in the past, and what I always pray for is that it's only confined to the uterus and it hasn't spread outside of the uterus. For most patients of treated, surgery was always the most important treatment. That meant usually removal of the uterus, the fallopian tubes, and the ovaries, because typically, if I'm going to recommend surgery, I like to get all organs out if the gynecologist agrees. In this type of cancer, removing of the lymph nodes is truly not necessary. In uterine sarcoma, and that decision really depends on the subtype and the tumor board. In many instances, the grade of the sarcoma is very important. One of the medicines that we use often, called the red devil or doxorubicin. Another one is gemcitabine, docetaxel, and I've used all of them. Hormonal therapy for a hormone-positive sarcoma is also an option. And unfortunately, if you leave the uterus behind, uterine sarcoma will come back. I've had many patients that have had removal of a portion of it, and unfortunately, it did come back. So it's very important that we pay attention to it. Even though uterine sarcoma are uncommon, the reason I made this video is that the treatment has improved dramatically. We got much better surgery, much better imaging studies. We now do hormonal therapy that are a whole lot better than 10 years ago, targeted therapy, and there are very exciting clinical trials. And my honest final message is, if you've been diagnosed with something in your uterus and it's not a fibroid and it's a sarcoma, please make sure you see somebody who has dealt with this before. The patients of mine that I'm treating, I look forward to seeing you soon, and hopefully we have a follow-up from your gynecologist that says nothing came back, and if there is a PET scan that shows something, it's going to be a cancer that we're aggressively going to go after. I wish you the best of luck, and I hope this has, to some extent, explained the fact that uterine sarcoma is not uterine cancer, and it's something different, and it should be treated differently.